patient, if there's one thing that I could say that it's important to know is to know that regardless if it's a clinic appointment, if it's in your own home or in the hospital, you are your best player. And you're your best player when you're informed and you're aware of the plan and ask the questions. Ask the questions that you're afraid to ask. There's no such thing as a dumb question. If it's something that you need to know that's going to get you the information that you need, always ask.
Thank you for joining us today. I am so honored to bring aboard one of our own concierge nurses here from Navi Nurses, who simultaneously works in a local emergency room. Her name is Amber Prong, and with all of her experience, she's going to detail why you're your best advocate and why the emergency room is just a bridge to where your healthcare really should be delivered, which is in the outpatient setting. We know that there's gaps there. We're going to talk about them and help you understand how to get the care you need outside of the hospital. I'm so excited to have you today, Amber. So grateful for you being here.
Thank you for having me. And this is actually my second month with Navi, and it's been such an amazing time just being in this space and being a part of Navi. So thank you so much for having me.
Thank you for joining. Just like to kind of start, now that you've said that, what's like the one thing that you loved so much about coming to be a part of Navi Nurses?
So when I started looking at potential other opportunities for nursing, I had a couple coworkers who were like, you should look into Navi nursing. It's something so my background is primarily emergency department, and it's so fast paced, and really connecting with your patients and doing care that is titrated to their needs. That's such a hard space to do that. And that's something that I've always really appreciated about nursing, and the time that I spent in the pediatric ICU. That was such a beautiful chapter, and that was something I connected with so deeply. And I was missing that. And hearing the nurses talk about that with Navi, I'm like, I think that's for me. And then when I really saw what your program and this whole company is about, the thing that I see the most in the emergency department is when outpatient fails. It's such a problem in our country and just how we treat people. And in the emergency department, we see what the poor outcomes are from that, or the disruptions and the consequences of that. Yeah. And it's something that is just, I see so often, and it's so devastating. And to be a part of a company that can service patients in such a personal and intimate way, that we don't see you as, these are the checklists that we have to do, that you're coming into our territory and we have to do this, this, this. Because of your insurance, this is what we can do. Because of your disease process, this is what we can do. And to be a part of Navi, I love being a part of something that is so specific and so unique to patients. That's what healthcare in our country is missing.
Yeah. Oh my gosh, I agree. That's like obviously what I saw in the hospital, right? Like the small things, like we make people be on our schedule. We make them wear our clothes. We make them take our medications, and like they have lost all their control of everything. I think when we admit them into the hospital, even the emergency department, like there's still an element of that there too. But it's nice to be able to sit with them and like see them as humans and not the chart anymore. Right?
Absolutely.
Oh my God, I'm so glad to hear that. Well, you shared a little bit about your story of your background as a nurse, like having the pediatric ICU experience and the emergency room. Can you share a little bit more, or tell us a little bit about your like nursing journey?
So I remember being in nursing school, and we had clinicals and all these different types of inpatient units. And I just remember thinking, I don't know if this is for me. There's something that I'm missing. And someone was like, you should try out the emergency department, be a tech there and see how that goes. And I was like, I'm not cut out for the emergency department. It's too crazy. There's so much happening. That's where some super really smart people go. And I was like, I don't know if I can do that. And I ended up getting hired as a tech, and in the first 5 minutes, I knew that this is home. This is for me. And so after I graduated nursing school, I went to a level 1 trauma center where I worked there for the last 6 years. I had multiple roles as a charge nurse, team lead, various different triage leads, and also spent an additional 4 years. We have a 9-bed ER ICU. So we got to do all different types of ICU treatment and take patients that you didn't necessarily need to be admitted to the ICU, and seeing if we can fix that, or doing lots of end-of-life care, comfort care. And I spent 6 years doing that. I also did 2 or 3 different type of nursing evidence-based fellowships, which was a lot of fun. And then I needed something different. There was a lot of growth that I wanted to have both professionally and personally. So packed my bags, went up to the Washington State, and then switched it up from adults only to the pediatric ICU. So I spent about a year there, and then it was time for a change. I was starting grad school and came out to Arizona, and now I'm at Mayo. I'm working in the emergency department, and now here with Navi.
Oh my gosh. I love that entire story. And again, I just want to point out like you highlight the beauty of nursing where you can switch up things and go around and like change directions and work in different like areas related
Exactly.
to nursing and healthcare. So, and you can do some at the same time and just like it fulfills, I think, our cup as
Yes.
like curious humans,
Mhm.
but also as like nurturing and loving and caring people that just want to make a difference for people. But oh my gosh, I love that. Thank you for sharing.
Yeah.
Okay, and like I feel like there's so many different things we can talk about here, and I know something that's really important to you is really empowering people.
Hmm.
And I think the first few things I want to ask you are, in your role as a charge nurse, maybe you can explain like what is it the role of a charge nurse for people who don't know, and what should people know about the charge nurse?
So being a charge nurse is a in the moment active leadership. And so every unit, their roles and responsibilities look a little bit different, but it's primarily being a captain of the ship and saying, okay, based on the storm that's coming in, whatever's happening, however our atmosphere is, we're going to make sure that we get through this shift. And so my responsibility looked a little bit different between when I was charge of the entire department versus charge of our ER ICU. But a lot of that is making sure, are my staff okay? Are we staffed? And if we're not, how can we do that? And then any patient throughput issues. Us as charge nurses, right now, one of the biggest things that we're dealing with is how can we move patients? If a patient needs to be discharged, let's get them out. We got to take care of them, but making sure that their plan is set up and how can we get them out in an appropriate way. And then making sure that if our patients have to be admitted, making sure that there's things that our nurses aren't missing so that way we can make that happen as seamlessly and as smooth as possible. And then always just making sure, how are my nurses? How's my staff? And if there's any patient escalations, patient concerns, making sure that I'm there to support my nurses and making sure that the right teams and right people are involved. But overall, since the pandemic, care has just changed and it's evolved in some really great ways. And then in some ways where we still have a bunch of work to be done. And the problem is that we have doctors who are working in these clinics, but their patient influx and their patient loads are doubling. They're growing exponentially, and we can't meet that demand in the best way. A lot of times, and we see it, I've seen it in the multitude of the hospitals I've worked in where, you'll get an appointment with the physician that you need to see that's super important for your care, but your appointment's not till 6 months from now. And a lot of the times, patients can't wait. And then they come to us in the emergency department where it's like, had you had your appointment, you could have gotten the care that you needed if it was within the next few weeks, but instead you had to wait, and that wasn't safe for you. That wasn't appropriate.
Yeah, and I'm just gonna like throw a little plug in here for Navi Nurses and the work that we do because we're seeing the same problem, right? Where people are waiting 3 to 6 months even after like having a big procedure done or they've been hospitalized, and they truly can't wait that long. But the really good thing about being able to hire a nurse to come in and just do an assessment and keep track of you at least until you can get into that appointment is that when we call and we're like, hey, Mrs. Smith doesn't look very good, here's what I'm recommending, like the docs will usually just give us the orders. Like we can get the labs, we can do all this stuff. They can get by for that 6 months. And God forbid, if there's something going on, we can actually help like get things addressed. So that way it doesn't fall through the cracks. Like their issues don't get missed.
And I've appreciated that so much because the thing that I see in the emergency department all the time, and I never fault patients for it because how can you? You aren't an expert in this field, but through Navi Nursing, I've already seen the communication that we have with our nurse navigators and our team that a lot of times the things that we need, patients would have to go to the emergency department. That's half your day. That's, depending on your insurance, anywhere from a $700 to a $2,000 bill. And sometimes you're charged that even for the simplest of things. And what I've really appreciated about Navi Nursing is it respects patients' time and it empowers them that you have what you need and you don't necessarily have to go through the big hoops to get what you need. That's not how healthcare should be.
Yeah, exactly. And it's funny too, because like when we think about the roots of nursing, and I know you're working on nursing leadership and you've done so much, you're growing so much as that professional, which is really cool. And I'm sure you'll probably appreciate this, but like nursing was never like, we never existed in hospitals. Like families hired their own nurse to take care of them, and they would come to them with to hospital when they were admitted, and they were like just the advocate for the family that was always consistently there. And it feels like we're moving back into that space.
Yep.
And, having someone who's unbiased and just really knows you and understands you to advocate for you. Because I'm sure, like in the emergency room, when people come in, maybe they're not responsive, like there's something really critically wrong with them, or they're just in a spot where they don't even want to talk, like they don't have energy, they don't feel well. And so they can't even advocate for themselves really well because they just feel awful.
Yeah.
Yeah. So I think, there was just something I wanted to hit on about that, just like the importance of advocacy. And I know like that's a big part of what's important to you is like people need to be their own best advocates.
Yes.
Right? Can you explain a little bit more about like how and why this is so important to you?
So I always tell patients, because one of the biggest things that I see in the emergency department is, and it's hard for us, and I want to give grace into the people who have neurocognitive memory complications. Those are, when you're in the emergency department, it probably wasn't on your bingo card. It's not the place you want it to be. It's a huge inconvenience, and oftentimes this is not your best day. And so I understand that when people come, it's so crazy and it can be really overwhelming and it's scary. Something's wrong with me. And you start to think, or people did Google MD, and they're like, Google is telling me I'm dying, I have cancer, and I have to have surgery tomorrow. And so I'm seeing these people, these awful high stakes situations, but it gets so challenging for us when patients aren't informed, and it makes it really hard for us to advocate for you when we don't know exactly what's going on. And it's so important because at the end of the day, no matter if you're at a clinic, no matter if you're at a referral, if you're right before surgery, you as the patient will always be your best player. You are the most important person in the room, but you can only be your best player if you're informed and if you can advocate for yourself. But back to giving grace to the people who have some issues where it's really hard for them, making sure that you have someone that you trust and that can empower you if you can't empower yourself.
Yeah. Can you elaborate a little bit more on the being informed part? So when you talk about it's really important to be informed, what does that look like? And what would be some ways that someone can make sure they're informed?
So I will often see, and again, I want to acknowledge and respect the space that when there's a really unfortunate turn of events, you're sick and something's going on, or you have a mental capacity where you can't do that's its totally own different animal.
Yeah, exactly.
But I had this the other day where a patient, so in the emergency department, we are most successful for patients when we can get things done quick. And it's a really challenging space to sit down, get to know you, and go through your whole entire medical history. We are not the most appropriate space to do that. We need like the cliff notes, quick and dirty, and the summary. And I'll have patients say, oh, well, just look in the chart. It's in the chart. I don't know, but I have a packet with a bunch of pieces of paper. It's in this packet. And in my environment, I'm happy you have the packet. I'm happy that you have that information. But when the people don't, or they say, oh, I don't know. Oh, I'm not sure. It's really difficult to manage. And health literacy is something that it's really tough to navigate in our country. When you look at what we have as a country, we're graded at about a 7th to 9th grade level of health literacy. And it's really challenging when people, I like to use this example. So I'm at the mercy, like I grew up, got a car when I was 16, but I don't know how cars work. I know that I can tell if something's shaking, rumbling, if my check engine light's on. I know that I have to go and get it looked at, but I'm at the mercy of whatever the mechanics say. And when they tell me, has this ever happened before? Do you know when was the last time you had? And I'm like,
when did you have your oil change last?
I'm so sorry, I don't know. What does the sticker say? And I'm not the most helpful in that situation. And I kind of relate that to your care, that even though if you didn't have that strong medical background, it's important to at least have a summary or know something. And what I think is a big challenge that people don't understand with healthcare systems is that not every healthcare system speaks the same language. So if I get care at one institution, everything's online and that's in my record, but that's not as easily transcribed. Like, it's 2026. You would think that with how far we've come with technology, it's a click away. It's, oh, this is so easy to be transferred, and it's not. There are so many security hoops that we have to jump through, and there's so many different types of healthcare softwares that exist where it's a totally different language, and the way that the data is stored and transmitted, it's not an easy process all the time.
Yeah.
And so what I recommend for patients is always have almost like a cliff notes of your story.
Okay.
Know that this is me. These are the conditions that I have. This is what's going on with me, and these are the things that we're working towards in my body. And you don't have to break it down like a neuroscience, like a neurologist. You don't have to break it down to the exact level, but when you have like a pitch for yourself, you kind of know what's going on, and bring the paperwork. If you can't recall it like that, that's okay. Learning medicine and sometimes understanding that in a fine-tuned detail is really hard for patients, but come prepared, know your story, and be able to explain it, and have something in place or a person that you trust that can support you if you can't support yourself in that moment.
Oh my gosh, that's such a great tip. Like, it's like having a face sheet of like, here's my medical history, like in a nutshell. So that way you can get to what you need to be doing faster. And I know like speed and efficiency is like what's so critical in the emergency room. And, there are people that wait sometimes for hours. And it's just, you never know like what's happening. Like sometimes we're like, is it a full moon? Like,
Yeah.
like why is everyone coming in now at this time? Like there's trends for sure. But you never know when you're going to end up in the hospital. Like people, like you said, it's not on their bingo card. They didn't plan it. But if they can be more prepared with this information, then the quicker we can get to figuring out what's happening, and we're more prepared to hopefully make the best recommendations. But that can only come with being given information, right?
Yeah.
I think a lot of times people will come into the hospital and they don't realize how much of a partner they are in the care.
Yes.
And we can't do it without them. Like, we need them to be active participants in everything that's happening. And we want them to be, because what we do as like the care we provide to them is so heavily dependent on what's happening and what they want.
Exactly.
Okay, so I want to kind of get into the juicy stuff, right?
Yeah.
If someone like as an emergency room nurse, what is the one thing that you really want people to know about the emergency room?
So I think
there's probably a ton.
There's so many things, but I think the most important thing for people to understand is that we won't always be able to give you the answer. I think a lot of people have, and it's not to their fault, but unrealistic expectations of the emergency department. And they think, okay, I can't get into my appointment, so they're going to give me all the answers. And I'm going to get my MRI, I'm going to get my CT, and then they're going to, book me into an appointment in the next couple of weeks, and everything's going to be great. Yeah. And the emergency department, our true purpose is to support you in emergent situations. And when we see non-emergent patients, that's okay. Our doors are open 24/7, and we will take you as you are, at your best, at your worst. But it is not a guarantee that when you come to the emergency department, we will give you all the answers. Our job and how we function best is to rule out emergencies. And we can tell you oftentimes what it's not, that we know it's not life-threatening, or it is, and we got to do X, Y, Z. This is a complication and a problem, and we don't know exactly what it is, but this is who you need to talk to. And we're often so much as a bridge. And my heart goes out to, I understand the frustration of the people where they're like, I couldn't get answers and I came to you. They're often desperate when they come to us. And it's something that's really hard for us, and it's heavy for us that when we see that, is that that's not what we can always do for you. And that's a really hard space to be in when we can't give you what you want. And I put myself in their shoes. I would want the same thing. It's frustrating not knowing what's going on. It's frustrating to be scared and to be in this like very unpredictable space where the answer isn't black or it's white. It's very gray. It's clear as mud. And I think that people need to understand that the emergency department is sometimes a bridge, and it's not the final destination or answer.
Yeah, that's really true. And I think like it feels so commonplace for us when we think about hospitals and the way they're designed, but it's also important for people to realize that like not all emergency departments are the same.
Yeah.
Right. So some are trauma, like there's trauma hospitals that take in the traumas, so the gunshot wounds and the car accidents and the real big things that are like severely life threatening with seconds. Like Mayo Clinic, for example, there's no trauma center there, right? So there's differences in the type of providers that are available. And then I also think about, just the hospital as a whole. So oftentimes, we tell people go to the hospital that matches the specialty that you
Yes.
really need.
Yes.
So if you have the ability, if it's a non-emergent, like I really don't feel well, I need to get this fixed, but and I can't wait to see the doctor sort of thing, go to the emergency room that matches the care.
That's such good
right?
advice. Yes, 100%.
Can you talk a little bit more about that too?
Yeah, so it depends. And again, because the healthcare in our country is just so diverse, and depending, like some states don't offer transplant services to people, and Arizona is such a big hub for transplants. And one of the things that's so important to guide patients, if your care is through this healthcare entity, it is in your best interest to stick with that. Because I think what people don't understand is when you sign up to a team or a new service, you start from the beginning. And it gets frustrating when they're like, well, I've already done this before, but you're new to us. It's like dating. We got to get to know you. And so when they're like, why, it feels like a first date. It's, well, that's what it is. And people then, well, I have to have this appointment. I have to then go through this process and this screening, and they get frustrated. That's more time. That could be a year-long journey. And we'll see patients too where they get so frustrated and they're like, my appointment is in 2 months, but I'm here because I want answers now. And then sometimes it's like you don't want to start the journey here. You have to stick with what you got, because for us, 2 months, that's not happening.
Yeah.
And it can't.
Yeah, that's such a good point too. And I've never worked in the emergency room. It's always been like in the hospital itself. And I remember, people would have all their imaging done somewhere else, and we'd have to like get it uploaded and brought into our system.
Yeah.
And then sometimes like because of just, regulations or just protecting the physicians and the nurses in the hospital they're at now, we have to redo all the stuff. So
Yeah.
there'll be a new MRI, a new CT. And so you're actually like doubling the work. But if people can pick the system that they think they need to go to and stay within that system, like you said, then that reduces the amount of like disruptions in communication, and your team can potentially collaborate better because they're all
100%. 100%. And that makes it easy and almost empowers the physicians when it's, I know this person, and sometimes they have these intertwined relationships that you didn't know about, and they can assist you better or make better recommendations of, this is who I think you should see. Whereas when you're, and granted, I also want to respect the space where sometimes a team isn't for you. You can onboard with someone and say, you know what, I don't appreciate the way that my care is being executed, or what my personal goals, what's important to me. I'm not getting that here. I'm not fulfilled in that way. And it's okay to seek second opinions and do that. But I just think patients need to understand that healthcare, unless it is like life or death situations, most of the time it's not as fast as it should be. A lot of times people will say, okay, I'm waiting for the team to decide. And that's great. But patients need to understand and empowered that they need to know and always ask, what's my plan and what am I responsible for? Because a lot of times patients will say, okay, I'm waiting for the phone call. Don't wait for the phone call. Make the call. Don't wait. Be aggressive. And even if they say, we'll call you back, if you don't hear back in a week, call them on Monday when they open at 8 a.m. Be empowered to not be pushy. It's a process, but to really take ownership and say, okay, what am I responsible for? What am I in charge of? Because then we also see oftentimes where this was something that you were supposed to do that was in your control, and then that fell through. And it's oftentimes just from a knowledge gap. I didn't understand. And those are things that we can prevent and we can do better to educate you and empower you to do. So I always want to encourage patients to ask, what am I responsible for and what do you need me to do?
Oh my gosh, that's a really, really good question for people to ask. Like, what am I responsible for? Whether you're going to a doctor, whether you are like picking up medications at a
Yeah.
pharmacy, right? In the hospital, emergency, like that's a really good question in general. Like, what am I responsible for? Because in these positions, you're like on overload. There is
Yes.
so much happening. And if it could just be brought down to like one or two bullets, I think you could walk away with like, okay, I know this one thing and this is what
Yes.
I'm responsible for,
Absolutely.
right? Like, I think I can do it. And it also made me think about like, there's a lot of people who they're in the hospital, but they don't have the resources to make sure that things can happen, right? Like, maybe they don't have transportation, they don't have like things in the environment to help get them to that next step. And that's why social workers are so important.
Yes. We literally can't do anything without them. They make our world go round.
Yeah, they help fill in those gaps.
Yeah.
And so I think it's important that people recognize that they are such a valuable part of the team for all of the things around to make sure that they have the knowledge and they're able to actually get to that next space on their own too. So yeah, social workers
Yeah.
they're so important.
And they're a resource that I think that people forget is in their back pocket. And it's sometimes as simple as calling the organization, and you're allowed to do that as a patient to speak to social work. They have case managers and social works that work really well together to help you. And they often, this was something that I wish patients like knew more, that this is something that you can do, you can use and utilize, because they really are such an important aspect of the team and can help fill some of those gaps. But that's not something patients are often told, is that this is a resource for you. This is someone who can advocate for you and help you with next steps. They often don't know that.
Yeah, no, they're so important. I'm also thinking about like I can't wait to get to this topic, which is I'm like okay, in the emergency room, time is money, right? Time is life. Time is everything, right? Like we talk about someone comes in with chest pain, like time to the cath lab, right? Time to like TPN or whatever if we think someone's having an ischemic stroke, all of the things. So, what do you think about time?
So I actually have a tattoo. It was my only tattoo, and it's "Time is precious." And it is something that for me, in my own personal mission, my vision and values, so to speak, that it's a gift. It's something that you can't, once you give it, you can't get it back. And how you spend it can either hurt or contribute health and add to your life. And in the emergency department, it's one of those things where we as a team respect that for people, and we know that your safety is determinant on the time that we do things. And with delays can be costly, delays can be detrimental and sometimes fatal. And it's something that is frustrating in today's healthcare because things take forever. It's wasting valuable time. Or when a patient has been waiting months and months for this appointment and it gets canceled, it gets rescheduled, or they end up getting sick 2 days before, and patients are like, please get me discharged by 9 a.m. I got to get to my appointment at 11 o'clock. And it's like, let's do it. Let's figure out how we can do this for you. But healthcare in general has shifted to, there are some things that we can do so speedily, and there's some things that unfortunately does take time. And a lot of that in the emergency department, our biggest beef with time right now is getting images done because we're so backed up. A hospital scanner isn't designated to just the hospital. There's outpatient patients coming in. There's patients that miss their scan that's funneling in. There's, oh snap, this emergent patient came in, they get the trump card, and then they have to, which is appropriate, that they have to cut the line.
Yeah, because they become a priority. Yeah, time is very precious. And I think one of the points you mentioned earlier is talking about how like we're waiting so long to be seen in the outpatient world. And I think that's because we don't have enough of physicians, we don't have enough nurse practitioners, we don't have enough of these like higher level practitioners who are able to help support people in the community. And because there's few of them for now so many people, they just can't see everyone. And so some of our clients that even come to us, they'll come in and be like, I went to go see my urologist and they have to see 42 people today.
Yeah.
And I'm one of them. Like,
And you get 20 minutes.
not even. Like this one person hired us to come in and be a second set of eyes and ears because the last urologist that they went to, they didn't feel heard or listened to. But like, this is one of the big problems that we're facing is that physicians are being like required to see so many people a day. And it's causing them to burn out too,
Yes.
just as much as it is like the system and the hospitals and like how things are operating even for nurses too. But that backlog in the community is what is now causing this like huge jam in the emergency room because people aren't able to see their primary care for the
Right.
really simple things. They can't get into their urologist, and kind of to your point of like they're frustrated and they just want answers. And they just turn to ChatGPT to learn and figure out what's happening to them. I would just remind people that, like, that's again one of the really awesome things that we can do at Navi
Absolutely.
Nurses. There's actually research that shows that if a nurse calls in, they can get into their appointment faster. And part of that is because we can give an assessment on the phone. And as a nurse, we're giving a recommendation. Like, they can't wait 2 weeks. Like, they
Yep.
have to be seen today. And they'll work the schedule around. So, like, being able to have a nurse that can come into your home and be your advocate, like they can advocate for getting you in faster, right? Like
Yes.
that matters. And some people have the ability to wait and like they're going to be okay. But for some people, like that delay in that care
Yeah, they can.
be life-changing for them.
Exactly. And that's the thing I really appreciate about Navi is it's not like why Navi, it's like why not Navi? Because what we are missing in healthcare in this country as people in general is that outpatient piece. And to have someone advocating for yourself, especially if you don't have a medical background, we don't expect you to know the ins and outs of everything. We don't expect you, you didn't that's just not a part of what you have to know, but it's your health. And Navi really does empower people to get the support that you need in real time. Because appointments, like we talked about, it's not real time anymore. It's months ahead, it's the future. And it's like my time is so valuable that it's important for my longevity, for my goals in my life and the things that I want to accomplish and do and how I want to feel at home. That voice is so important in that interim.
Yeah, and you brought up a really good point earlier that I wanted to just kind of circle back around to, and that's health literacy. And I just wanted to highlight that we're all like health illiterate in some ways.
Yes.
Right? So even we'll take care of other doctors and scientists, PhDs, and even the most brilliant people have health literacy issues. Myself, like my background, I started in neuro, ENT, and plastics. Like that's what I know and I understand. I'm like health illiterate in like all the complexity of cardiology. I'm health illiterate in all the labor and delivery stuff. I have enough basic knowledge to get me through and to get through appointments, but I don't know those details that are actually really important. And so I want to make sure that people understand that, how do I describe it? Like they're not intended to know everything, right?
Yeah.
They're really not. But as much as they can inform themselves, that's definitely really helpful. But if they can have someone who is like advocating or helping them understand, that's really helpful because especially when you're leaving the hospital, you're leaving the emergency room and you're given a whole packet of stuff. It's like, I have
What am I
all this
supposed to
stuff
do
to
with this?
read, right?
Yeah.
Like, how do I boil this down to like that one question that you said, right? Like, what am I expected to know and do next? Like, if we could boil everything down to like, really, what are my next steps and all the things, I think that would be so much easier.
It would change the world. It would change healthcare. And not to sound like, so dramatic, but it would. That's what we need. That's what people need. And especially with the baby boomers and the numbers, like we know that those patients in the geriatric and elderly population, that is growing and it's growing at an exponential rate. And when you look at the statistics of nursing, just specific to nursing, physician entities and physician burnout is its own numbers in its own group. But I mean, within this year of 2026, in 2025, they had expected where in some, like it was 450,000 nurses were expected to just leave the profession altogether. And what we're doing here at Navi, these are the things that can fill those gaps. And that's what we're seeing in the hospital is because we don't have things like this. That's why we're seeing in part what we're seeing inpatient and in those settings and how we're feeling outpatient.
Yeah. You bring up like another little point too I want to add on, and I think you'll be able to speak to this probably pretty well. We see nurses going on strike, right, around the country, and they're going on strike because of like unsafe staffing, and they don't feel like they're working in good systems that support them. And when I say not support them, they're not oftentimes given the resources or the time or the people to help them do the job that they feel proud of at the end of the day. Because as nurses, I know for me, there were so many times I would leave the hospital and be like, oh my God, I didn't do this. I got to that late. I wouldn't think about all the things I did good or I got to, or the things like I saved someone's life or caught a huge error.
Yeah.
I would go home thinking of all the things I didn't do. And so I'm wondering, what would you say to someone listening about why it's important to pay attention to nurse burnout? Why is it important that we look at these nurses who are striking and see it not just about they want to get paid more, right? Because I think there's a lot of talk about they're striking because they want to get paid more. And I don't think it's like number 7 on the list, right? There's other things, but what should people know about the heart of nurses and why they're doing this?
So I think that is a very deep topic, and there are so many aspects of the why and the what. And the problem, kind of back to the pandemic, most hospitals in the pandemic were not financially successful. And if you are not financially successful as a hospital, it's a business, you have to be. How far back a lot of healthcare systems went was pretty far back, and they are still paying the prices. And I've been a part of multiple strategic conversations, financial plan initiatives for some pretty large healthcare entities. And you can tell, if this is the level of urgency, it's very smart and it's wise, but what I'm hearing, I know that this is a big issue. And a lot of the problem is so many hospitals have shifted, and granted, it's a business. You must be successful so that you can be successful to your patients and your staff. That's absolutely, but it seems like so many hospitals have been backed into this fiscal corner where your success is measured based off of how much money you make. And we're still expecting nurses to achieve that same excellence, but we've cut those resources in half. And we're saying that this is what you must do, but I may not be able to give you all the things to do it. Go forth and prosper, but I don't know if I can help you prosper. And that's a really hard space to be in for nurses, because at the end of the day, I think I can speak for most nurses when I say that we became a nurse, we chose this to help people. We have our best interest for others. But nurses, a lot of times in those situations, the patients that we're seeing is totally different. The pandemic changed the world. It changed so many people's ability to cope with stress. It was a hard and awful time for so many people. And I think for us, we're still in such a recovery phase where it's like I even had a conversation with someone the other day where the pandemic, that happened. We couldn't go outside. We couldn't, people were wearing gloves at grocery stores. It was so crazy how life was so different, but I don't think we give ourselves enough grace if that was a pretty traumatic time. And especially for patients who had to go through that and that fear, and us nurses who had to take on a lot of that emotional, physical load. And when you're looking in the emergency departments, and I'm sure I can't speak to inpatient, but I know you guys, if we're feeling it, you're feeling it too.
Yeah.
Patients are more aggressive. People are more agitated, more frustrated. And I think everybody is feeling that heaviness. And us nurses, it's hard to show up for people while carrying that heaviness, while we're expected to be there for people on their hardest day. It's been a real challenge for everybody. New nurses, middle nurses, older nurses, it's across the whole spectrum.
Yeah. Any last thoughts that you want to share with just anyone about being in the emergency room or being in the system, or just anything that is really important you think someone should know?
I think one of the most important things I can say for patients is that you give yourself some grace. It's hard being sick. It's hard getting older. And regardless of what it is, whether it's a clinic appointment, whether it's going into the emergency department, a new admission, or meeting a doctor for the first time, you are your best player. And you are your best player when you are informed. And when you're informed, and even if that means that you have a friend, a loved one, or someone that you trust that can be a part of that and be on your team, you give yourself so much power and you get to be in the driver's seat. And that's, I think, one of the most important things that can set you up for success and determine the kind of care and what your life is going to look like.
Yeah, and there's something so empowering about that. You can be in the driver's seat, right? We've got to get patients to realize that. I feel like there's that hierarchy almost in a way of like we see the medical team as like, oh, they know all, they do all, but like you know all actually. Like you know your body better than anyone else. So like take control, hop in the driver's seat because you can and you deserve that.
Absolutely.
Yeah, I love that point. Thank you for bringing that up. So good. Oh my God, what a great conversation. I cannot wait for the world to see like and listen to just everything that you just shared. Some conversations have just one golden nugget that is life-changing. In today's conversation, it was exactly that one question that Amber talked about. What am I responsible for? If there's one thing you walk away with knowledge of today, please make sure in every encounter with your healthcare team, you ask them, what am I responsible for? And that clarity will hopefully give you all of the resources and tools that you need to feel confident enough in managing your healthcare from that point forward.